Obici Hospital was actually a gift to the community from Sentara Obici in 1951. The gift to the community sort of just plays into this program because this is a gift to the community by the Obici Foundation that started the funding for the program. The program is actually based on the premise that if people with heart failure and diabetes really have what they need to control their disease, they definitely will. If you have nothing to help yourself with, then you are going to be in and out of the hospital on a constant basis.
We bring them into the hospital and we perform surgery or major tests, get them on proper medication only to go home to recur into the same problem. It's very frustrating that the patients have the cognitive ability not to care for themselves or social issues that make it very difficult for them to understand what to do.
The thing that drives me to want to send a patient to the outpatient program is these patients who have chronic medical conditions, frequently congestive heart failure, chronic obstructive pulmonary disease, who come to the hospital time after time after time because they have a difficult time managing their disease at home, either with not being able to take their medications properly, not eating a good diet, and just not being able to adapt and adjust to their disease with their surroundings.
It's like a physician extender when you have these case managers in the patient's home. And the doctor may say, eat this, don't eat this, do this, don't do that. But the reality of the situation is you've got to meet the patient where they are, in their home.
I got a heart condition, I had a small lung condition, I have high blood pressure, I'm a diabetic.
But he was a little bit hesitant as to what I was going to be able to do for him because he said he had been so sick for several years and he just couldn't imagine how he could get better. So he was a little bit hesitant. And as I started working with him, he had not been fixing his medicines in a med dispenser. He had not been checking his blood sugars on a daily basis. He would just get up and give insulin and even forget to eat.
Just go day for day, you know, because I didn't have this type of equipment. You know, until Nurse Barbara came in, she told me, she said, well, I'm going to bring you scale, monitor for your blood pressure and your sugar and all this. You know, and if it weren't for that, you know, I've been in trouble. I look at it this way. Since you've been coming, I've been out of the hospital.
A Sunday morning, my pay is out.
Mr. Watson is an 84-year-old diabetic patient that I was referred to 11 years ago. He had been admitted to the hospital in a coma with a blood sugar over 1,000 that was newly diagnosed for him. At this point, Mr. Watson is just diet controlled. We have gone through weaning off of insulin, weaning off of diabetic medications, and for the last 8 years, he's just been controlled by diet.
Without the doctor and the nurse, I wouldn't be around. I don't believe.
I walked in there with my blood sugar 974, argued with the whole family, and told everybody there was nothing wrong with me.
He lives out here alone, and so I'm the extra person that comes out and care for him and make sure that he keeps on track in what he's supposed to be doing to lead a healthier lifestyle.
I could drink that alcohol and take that insulin, and in the middle of the night, I could have gone to sleep and not woke up. I had no idea.
Who taught you the difference?
Barbara. She fussed at me, which I shouldn't say fussed at me, she coached me. She would sit there and she would tell me everything that's going on. She says, look, this is the real deal. These are the facts. This is why this program is so important.
Yeah. What would it be like without it?
Be dead. I would be. Honest to God, I would be dead.
It's probably one of the most important outreach programs we have here at the hospital. It's been a real boon, and I think it's unique to this hospital and the Obici Foundation, which started it, and it's continued. But you know, going forward, it's a very important part of our program here at the hospital.
This is not something that requires a great deal of expertise. It does require a great deal of caring.
Caring is one of the most therapeutic things that one person can do for another, and that is what our nurses do.